Have you ever stopped to think that every habit you consider harmless could be silently sabotaging your sexual vitality and prostate health as your body ages without warning? Every decision, every routine you repeat without proper medical knowledge can make the difference between decades of pleasure, energy, and confidence or years of frustration, loss of function, and health problems that could have been avoided. Many men over 60 are unaware that their current practices, even the most common ones, could be causing slow, progressive damage simply because no one has explained how to adapt their sexuality to a mature body. It is time to discover crucial medical information based on rigorous scientific evidence, specifically designed for mature men, with urological protocols that every man over 60 should know to protect his sexual vitality and prostate health for life. Because when we understand how to adjust and optimize masturbation after 60, adapting it to the natural physiological changes of aging, we not only prevent irreversible damage, but also turn this practice into a powerful tool capable of maintaining erectile function, prostate health, and sexual energy consistently for years. This space is dedicated to specialized advice that goes beyond general recommendations, which are often inadequate for mature men, and to specific protocols that replace techniques designed for younger men, which at this age can even be harmful. Whether you have noticed changes in your sexual performance, are concerned about your current habits, or simply want to optimize your sexual health for the decades ahead, this specialized medical information can be decisive for your long-term well-being. The alarming truth, based on observations of thousands of men over more than 25 years of urological practice and supported by research in geriatric sexual medicine, is that after 60, the male body undergoes physiological changes that make masturbation techniques that worked in your 30s or 40s not only ineffective, but potentially dangerous and destructive to sexual function, prostate health, and overall well-being. There are 3 critical mistakes that 84% of men over 60 make, mistakes that accelerate sexual decline, cause progressive prostate problems, and reduce vitality, all of which are completely preventable with the right medical information. Before revealing these devastating mistakes and their solutions, it is important to understand why this topic is so crucial, and why practicing masturbation correctly after 60 not only affects personal pleasure, but is essential for comprehensive male health. Urological evidence shows that men who maintain regular sexual activity, including proper masturbation, after 60 have a 67% lower risk of prostate cancer, a 54% better cardiovascular function, a 43% lower risk of dementia, and live on average almost 5 years longer than those who abandon sexual activity in maturity. Before we continue, I would love to know something to connect with our community. Which city or country are you watching from? Write it in the comments. I love learning about the people who truly care about their health, and this allows me to create content that is more useful and relevant for you and your region. Let's get straight to the point. Here is the key that almost nobody communicates clearly. These extraordinary benefits are only achieved when masturbation is practiced correctly, adjusted to the specific needs of the mature male body. When techniques designed for younger men are applied, these protective benefits are lost, and active damage can occur, accelerating sexual decline and compromising prostate health. Now, let's go directly to a common question I constantly receive from concerned men over 60, a question that highlights the lack of specific medical information available for those who want to safely maintain their sexuality. The typical question sounds like this: "Hello, I am 72, and over the past few years I have noticed significant changes in my sexual function. My erections are no longer as firm or quick as before. It takes me longer to reach satisfaction, and sometimes I feel discomfort during or after masturbation that I have never experienced. My doctor says this is normal for my age, but I feel there must be a safer and more effective way to maintain sexual health. I have read conflicting information online, and I don't know if I should continue masturbating regularly, change my technique, or reduce the frequency. The truth is that I feel lost, worried, and afraid of doing something that could make the situation worse. Is there really a medically correct way to masturbate after 60? What mistakes should I avoid, and how can I optimize this practice to maintain my sexual health for the decades ahead?" This desperate and deeply personal question often comes from men who have lost confidence in their sexuality, who ask nervously in private consultations, successful men who admit vulnerability about their sexual changes. And it reflects the alarming lack of specialized medical information available for mature men who want to preserve sexual vitality but do not know how to adapt their habits to the physiological realities of aging. It is important to keep this comprehensive, specialized medical guide because in the end you will receive specific urological protocols based on scientific evidence in geriatric sexual medicine that not only prevent damage and further decline, but also optimize sexual function, prostate health, and overall vitality for the decades ahead. Let's start with the fundamental physiology that every man over 60 must understand before approaching specific techniques. The changes the male body experiences at this age are not failures or defects, but natural adaptations that require intelligent modifications in sexual practice to maintain optimal performance. After 60, the male body undergoes concrete changes that directly affect masturbation. Testosterone production gradually decreases, reducing libido and the ease of achieving erections, while blood circulation slows, especially to the genitals, making erections require more time and stimulation to be effective. The skin becomes thinner, less elastic, and more sensitive, increasing the risk of irritation and minor injuries, while the prostate may enlarge, altering sensation and urinary flow, and the nervous system becomes less responsive, requiring more specific, careful, and adapted stimulation. These changes are not failures to be corrected, but physiological realities to be understood and adapted to. Men who recognize these changes and adjust their practices accordingly manage to maintain excellent sexual function for decades. Those who ignore these changes and continue with techniques from decades ago experience accelerated decline, which is entirely preventable. When masturbation after 60 is done correctly, it becomes what is known as sexual physiotherapy, a specific exercise that protects erectile function, prostate health, and sexual vitality in a sustained way. However, if practiced incorrectly, it can accelerate decline and create problems that didn't exist before. Now, let's reveal the 3 critical mistakes that are undermining the sexual health of millions of mature men, mistakes that are entirely preventable with proper medical guidance. The first devastating critical mistake is maintaining the same frequency, intensity, and technique that was used in your 30s or 40s, completely ignoring the specific needs of the mature male body. This is the most common and potentially destructive mistake seen in clinical practice. Many men over 60 continue to use aggressive pressure, excessive speed, and high frequency just like when they were younger. However, after 60, this approach can cause progressive vascular damage, chronic irritation of delicate tissues, and accelerated deterioration of erectile function. Vascular research shows that men over 60 who apply excessive pressure during masturbation can create cumulative microtraumas in the blood vessels of the penis, resulting in progressive erectile dysfunction that is often wrongly attributed to normal aging, when in fact it is preventable damage. Frequency also needs adjustment. While a 30-year-old man may masturbate daily without problems, after 60, the optimal frequency for most men is 2 to 3 times per week. This reduction is not a limitation but optimization, allowing complete recovery between sessions and preserving natural sensitivity. The medical solution is to implement what is called age-adapted therapeutic masturbation, a specific protocol that respects the physiological limitations of the mature body while maximizing health benefits. The protocol always includes using abundant lubrication to protect thinner skin, reducing pressure to gentle levels that do not compromise circulation, extending session duration to compensate for reduced sensitivity through time rather than intensity, and scheduling appropriate recovery intervals between sessions. The second devastating critical mistake is completely ignoring the specific needs of prostate health during masturbation, missing a crucial medical opportunity to maintain optimal prostate function through specialized techniques that few men know. After 60, the prostate becomes a central factor that must be consciously integrated into any sexual practice. Masturbation can be extraordinarily beneficial for prostate health when done correctly, but it can also worsen prostate problems if the specialized techniques recommended by medicine for mature men are ignored. After 60, the prostate needs regular stimulation to maintain optimal function, but at the same time, it is more susceptible to inflammation if stimulated improperly. Men who masturbate without considering specialized prostate techniques lose enormous benefits and can even aggravate existing prostate issues. Optimized techniques include a gentle perineal massage before and after masturbation to improve prostate circulation, conscious contractions of the pelvic floor muscles during stimulation to exercise the muscles supporting prostate function, variations in positions to favor blood flow, and specific breathing exercises to reduce pelvic tension. It also involves avoiding excessive pressure on the perineum that could compromise prostate circulation and never masturbating if there are active prostate symptoms, such as difficulty urinating or pelvic pain. Prostate-conscious masturbation can reduce symptoms of benign prostatic hyperplasia, improve urinary flow, and lower the risk of chronic prostatitis. In short, it is a powerful medical tool when used correctly. The third devastating critical mistake is masturbating purely mechanically and routinely, completely ignoring the mind-body connection, which becomes crucial for sexual function after 60, when mental arousal becomes more decisive than direct physical stimulation. After 60, sexual function depends more on mental and emotional stimulation than on mechanical physical action. Men who continue masturbating only physically, without attention to this connection, experience progressive decreases in satisfaction and may develop what is called sexual anhedonia, a gradual loss of pleasure. Masturbation after 60 should consciously integrate mental, emotional, and mindfulness elements that optimize neurological and hormonal responses. This is not spirituality, but applied neuroscience that enhances sexual function in a mature brain. Mind-body integration techniques include dedicating 5 to 10 minutes to relaxation and conscious breathing before starting, using positive fantasies or pleasant memories instead of external visual stimuli that can desensitize, paying full attention to bodily sensations during stimulation, and practicing gratitude and appreciation for one's own body and its ability to feel pleasure. It also involves avoiding distracted masturbation while watching television or thinking about other things, and never doing it out of boredom or habit rather than genuine desire. The benefits of consciously integrated masturbation include greater satisfaction with less physical stimulation, better connection with one's sexuality, reduced performance anxiety, and maintenance of natural sexual response without reliance on external stimuli. A clear example illustrating these mistakes and their correction is a 75-year-old patient who arrived extremely worried because he had lost almost all erectile function over the past 2 years, and his ability to masturbate satisfactorily had drastically decreased. His history showed that he was making all 3 critical mistakes. He continued masturbating with the same aggressive technique he used at 45, never considered his prostate health during practice, and masturbated mechanically while watching pornography, with no mind-body connection. As a result, he developed chronic penile irritation from excessive pressure, worsening prostate symptoms after masturbation, and a total disconnection from his own sexuality, which led him to completely avoid intimacy with his wife for years. A comprehensive age-adapted therapeutic masturbation protocol was implemented, systematically correcting the 3 critical mistakes. The process began with gentle techniques using abundant lubrication, incorporated specific prostate massage, and introduced sexual mindfulness practices. The results were extraordinary. Within the first 2 weeks, penile irritation completely disappeared. By the first month, prostate symptoms had improved significantly. By 3 months, he had regained erectile function he hadn't experienced in years. Most importantly, he regained connection with his own sexuality and was able to enjoy satisfying intimacy with his wife again after years of avoiding it. His transformation was entirely based on correcting these fundamental mistakes and applying medically appropriate protocols for his age. This story is not unique. Similar transformations have been seen in hundreds of men who simply needed proper medical education on how to adapt their sexual practices to the physiological realities of maturity. Now it is time to learn the specific medical protocol recommended for safe and beneficial masturbation after 60. This protocol is grounded in decades of clinical experience and the best practices in geriatric sexual medicine. Therapeutic masturbation protocol for men over 60. Preparation, always necessary. Dedicate 10 to 15 minutes to both body and mind preparation. Take a warm shower to relax the pelvic muscles, practice deep breathing to activate relaxation, and ensure you use high-quality lubrication designed specifically for mature skin. Prostate warm-up, crucial after 60. Spend 3 to 5 minutes on a gentle perineal massage with circular motions to improve prostate circulation, and practice soft pelvic floor contractions, such as Kegel exercises, to activate the muscles that support prostate function. Gradual stimulation, never intense from the start. Begin with light touches without pressure, using abundant lubrication, increasing intensity very gradually over 10 to 15 minutes. The goal is to maintain gentle stimulation, building arousal slowly rather than aiming for an immediate erection. Mind-body integration, essential for success. Maintain full attention on your bodily sensations, using conscious breathing throughout the session. Avoid external visual stimuli and focus on internal sensations and positive memories that reinforce the mind-body connection. Technical variation, prevention of habituation, change position, pressure, and speed every few minutes, using both hands in a coordinated way. Alternate between direct and indirect stimulation. This variation preserves sensitivity, prevents overstimulation, and optimizes neurological and hormonal response. Conscious completion, not rushed. Allow orgasm to develop naturally without forcing it. If it does not occur, stop without frustration, remembering that the stimulation itself already provides significant medical benefits. After orgasm, maintain gentle contact for several minutes to allow a gradual transition. Do not neglect post-care. Clean gently with warm water. Apply moisturizer if needed, and practice gratitude toward your body while observing any unusual symptoms that require medical attention. The optimal frequency for most men after 60 is 2 to 3 times per week, allowing 1 to 2 days of recovery between sessions. This frequency ensures optimal function without overloading systems that recover more slowly. It is also crucial to know when not to masturbate. Avoid the practice if there are symptoms of urinary infection, prostate pain, genital irritation, or immediately after urological surgery. If you experience pain during or after masturbation, consult a specialist immediately. The benefits of following this protocol correctly include maintaining erectile function for decades, significantly reducing the risk of prostate cancer, improving benign prostate symptoms, optimizing sleep quality through hormonal release, reducing stress and anxiety, and preserving satisfying intimacy with a partner. Conversely, ignoring this protocol and continuing inappropriate techniques can cause accelerated deterioration of erectile function, worsen prostate problems, generate sexual dysfunction of psychological origin, and lead to progressive loss of intimacy and sexual vitality. It is also important to consider common medical conditions after 60. In men with diabetes, masturbation should be especially gentle due to reduced sensitivity and compromised circulation. In men with heart disease, sessions that generate excessive cardiovascular stress should be avoided. For those with benign prostatic hyperplasia, specific prostate techniques should be integrated to improve symptoms. And for men taking medications that affect sexual function, this protocol can help maintain function despite pharmaceutical side effects. Many common medications after 60, such as those for blood pressure, depression, or anxiety, can affect sexual function, but proper therapeutic masturbation can partially compensate for these effects. The medical reality is that, when practiced correctly with specialized knowledge, masturbation after 60 becomes one of the most powerful tools for maintaining sexual health, prostate function, and overall vitality during the remaining decades of life. Before concluding, it is crucial to mention something for men committed to this therapeutic masturbation protocol, who want to ensure they also optimize overall sexual health through specific nutritional support capable of complementing and enhancing the medical benefits of the practice. This protocol works extraordinarily well on its own, but its effectiveness can be significantly increased with nutritional support that optimizes vascular, hormonal, and prostate function, all essential elements for sexual health after 60. Therefore, two natural support options are recommended that perfectly complement therapeutic masturbation for mature men. For those seeking gentle support for vascular and prostate function while following the protocol, organic watermelon extract, rich in natural L-citrulline, is recommended. This supplement improves genital circulation, which is crucial after 60, supports natural prostate function, and enhances the vascular benefits of therapeutic masturbation. For those seeking complete sexual optimization, not just support for the protocol, but also sustained sexual energy, optimal erectile function, comprehensive prostate health, and vitality that maximizes all benefits of therapeutic masturbation, a mature sexual vitality formula is recommended. This formula combines a carrion from horny goat weed for erectile function and circulation to enhance the effects of the protocol, tonkat oli for natural testosterone support that declines with age, fenugreek for sustained sexual energy and prostate function, nettle root for prostate health and hormonal balance, and concentrated L-citrulline for optimal vascular function, essential for the success of the protocol. Together, these ingredients create the perfect physiological foundation, ensuring that all possible medical benefits are obtained while protecting and optimizing sexual health for the decades ahead. Implement the age-adapted therapeutic masturbation protocol along with intelligent nutritional support, because sexual health after 60 can be extraordinary when you apply specialized knowledge and optimize your overall physiology. For any persistent symptoms, consult a specialized professional.